But I was standing looking at the window as far as I know. Next thing I was falling backwards, caught myself on the chair and then caught out the hot radiator, left go and ended up on the floor. Called an ambulance and that was it. I ended up in hospital. I was assessed. They took me for an x-ray. They found that I didn't have anything broken, so they thought they better check with a CT. Nothing showed up on that either, so I was put down to Durrington ward. But I was in there sort of 6 days. I think in hospital you've got the feeling that you're ill and you could easily give in to the feeling and not push yourself to do things. You feel better at home, you feel more well at home. If you can't reach it, you've got to make yourself do it and get on with it. If you don't do it yourself, you'll never get there. You just need to be encouraged to get up and go. And when I heard that you could get sent home early, I thought that was a good idea. And then the help you get when you got home, yes, please, I said.
We started in October 2016 with the primary focus of early supported discharge for hip fracture patients. But within that, it quickly became apparent that there was more potential to expand the service across the different inpatient wards. So the aim of the service now is to support patients in getting home. At the moment, the ward therapists will refer a patient to us, and then we go and meet the patient on the ward and read their notes, understand where they've come from. And the first question that I always say to the patient is, do you want to go home? And 9 times out of 10 the answer is yes, when can I go? We often do a discharge home visit so that we can settle them in, because often that's the biggest source of anxiety, is getting physically out of the hospital and into their homes. They are often quite worried about that. It seems like a big transition, but once they're settled into home, they're more than ready to say, you can go now. Normally we do daily visits to start with, but quite often those are cut down to a telephone call within a week, 2 weeks maybe. It always happens quicker than we expect and still takes us by surprise how quickly patients rehab once they're in their own environment.
I received quite a lot of support from the team, and they talked things over with me, and I thought then that it was a good idea. I'd rather be home. I thought I'd have to have carers in or something like that, but when they said they support me, I felt that was the idea for me. Let me get home. Because I think in your own environment you get on better, and I wanted to be back with family that would back me up as well as good neighbours, and I think you were much better able to cope with things, I think, in your own home as opposed to being in hospital.
Home first is really what it says. For patients, the most important place they want to be is in their own home, and over the years some of the ways we work have meant that people spend longer in hospital than probably is ideal for them or us. And so Home First is a new approach to thinking about deciding what people's long-term care needs are once they get home, rather than doing that while they're in hospital. It's really important to listen to patients because they are the experts about themselves. They know what they want, and we should be enabling them to do what they want to do with the rest of their lives. What's different about Home First is the way we assess patients. Currently we do this in a hospital setting, in kitchens that aren't people's kitchens, on stairs that aren't people's stairs. Home First allows us to do that assessment in their own environment, and what we're finding is, not surprisingly, people function much better in their own environment than they did in a hospital, and it means the packages of care and outcomes in terms of long-term care are changing completely because we've overprescribed care in the past.
Once I got home, the team got me settled in to make sure I could cope, and then they came out to help me, advice, cheerfulness, everything you could think of. They just helped me so much. I wouldn't be where I am now if I hadn't had the support of the team. They really did help. Well, I think the patients know more than anybody what they really want or need, and I'd recommend definitely to go home with the early release team because it makes life so much easier for them. More normal, down to earth, doing what they want as opposed to what people probably thought they should do. I think each person knows themselves what they'd rather have.